Good evening, everyone. Um, I'm back like I promised. I'll be talking about drug reactions this evening. Drugs, they have the tendency to heal and they also have the tendency to kill. That is why in clinical practice we say that all drugs are poisons because when they are used in a way they are not supposed to be used, they can present an unexpected or undesirable reaction in the body, which can take someone's life. Even as simple as paracetamol. When paracetamol is taken in an overdose, it can cause a liver cirrhosis, which could be very serious, which can take somebody's life. It can be fatal. Uh, so we try as much as possible to study, to upgrade our knowledge of studies, to enable us to know the reactions in which some of our patients experience with respect to the drugs we give to them. That is the essence of follow-up, because by the time you give someone a drug and you are able to follow the person up, the person will be able to give you a feedback on what he or she is experiencing with the drug that you gave to him or her. Uh, so, so there are some misconceptions, especially with our parents. You know, there is this knowing that when you give a child a drug and the drug happens to be reacting on the child's body, and maybe you start seeing rashes on the child's body, all of a sudden you start seeing rashes on the child's body, and most of our parents believe that the drug actually went inside and it is pursuing the sickness outside. And not knowing that actually it is drug reaction that have set in. That child is actually reacting to that drug. So drug reaction is a very serious, it's a very serious, it's a very serious subject in clinical practice. It's a very serious subject in clinical practice, and that is why we try as much as possible to read our books. Like as a pharmacist, I am a lifetime reader. I can never stop reading, because when you stop reading, then the information that you already have, one day it will become a cake. Because sometimes some drugs could be reacting with maybe another drugs today, but when it is discovered that these two drugs do react together, some adjustment can be made to that with respect to that drug, such that such a reaction will not take place again. So if I'm not the kind of person that upgrades my knowledge, it means that I'm not going to know that something of such has been done. Whereas I will just be going around talking about what I know, and maybe doubting when somebody tell me the recent upgrade in medical sciences. That is why I say that here we bring you upgraded uh, medical scientific informations to help you with how you take drugs, to help you with how you take medicines. Uh, let me state something here. All drugs are not medicines, but all medicines are drugs. I know that it might be confusing. I said that all drugs are not medicines, but all medicines are drugs. Before a drug is qualified to become a medicine, it might have undergone some kind of clinical trials and safety trials to ensure that it is safe for human use. By then, it will become a medicine that can be used in the clinical practice. So I would rather now be using the name medicine so that you will know that what I'm talking about specifically. Because if I'm using the word drug, so I understand that you also know what I'm talking about. That is not the right register, or that is not the right English that I should be using. I'll be using the English medicines. So there are different kinds of reactions with respect to medicines. Okay, at this point now, permit me, because this classification, I will classify it based on how it is classified in the literatures. So reactions with medicines are categorized into different in different ways. Number one is drug-drug interaction. Number two is drug-food interaction. Number three is drug-disease interaction. And we still have something like drug receptor interaction. Yes. So I will just be throwing a little light on some of these interactions so that you will know whether some of them has happened to you before or has happened to someone you know, so that you can easily give someone an advice when such a thing occurs to the person. You see the relevance of having these informations. For example, somebody that is having ulcer cannot take diclofenac or ibuprofen. This group of drugs, they are called the NSAIDs. They are actually painkillers. But the reason why somebody that has ulcer cannot take it is because they actually aggravate the ulcer on their own. They can even cause ulcer on their own. Now, talk less of giving it to somebody that already have ulcer, and the person can even start coughing and start coughing out blood. It can be as serious as that, and depending on the blood vessel that is being ruptured in the body, the person can be stooling blood, vomiting blood. Blood can be coming out from the person's nose if a major blood vessel has been damaged. So that is why when you come to buy some of these painkillers, a good and a reasonable clinician must always ask you, hope you don't have ulcer, because there are different painkillers which has been prepared for people that have ulcer, and the ones that they don't react to. So that is an example of drug disease reaction. Example of drug-drug interaction is when you take two drugs together and they goes into your body and they interact, thereby changing into something entirely from what the two of them used to be. Their identity tends to change. In this case, we have some reactions which can be synergistic. Some of those reactions which can be synergistic, they could be of advantage in treating some diseases, whereas there are not some that are non-synergistic, and they could be very toxic. They could be very toxic to the human health. So in a drug-drug interaction, the one an example of a drug interaction that is synergistic is the type we have with metoclopramide and paracetamol. Metoclopramide is a drug used to stop vomiting. And paracetamol, it's an aniline painkiller. So when these two drugs are combined together and taken together, they can be used to cure or relieve somebody of migraine headache, because the metoclopramide actually makes the paracetamol to react faster, can make it to even start acting under 5 minutes, thereby relieving the person of the migraine headache than when the person takes only paracetamol. So there are also let me still give example of toxic drug reaction which is not good. Example of that is what we have with taking chloramphenicol with paracetamol. Paracetamol shouldn't be taken with chloramphenicol. Normally, the half-life of paracetamol is estimated to be like 4 hours. So it means that by 4 hours, the paracetamol should have been disintegrated, and it should have started working. But then by next 8 hours, another dose will be taken. That is why you see that we usually dose paracetamol. For adults, you dose it 2-3 times. It comes in 500 milligram, which means 1000 milligram 3 times for adults. And for children, depending on the age of the child, we can dose 1 tablet 3 times. So when chloramphenicol is given with paracetamol, the chloramphenicol can delay the effect of the paracetamol with 23 hours, which is close to 1 day. So it means that if you take chloramphenicol with paracetamol, the paracetamol is not going to work. It is not going to work in your body, because the chloramphenicol delays its action. It delays its action in the body. And we have other reactions which can be toxic in the body. There is this reaction that we call disulfiram-like reaction. Disulfiram-like reaction. It is a reaction that occurs when you take metronidazole. Metronidazole is actually called flagyl. I'm sure you know that alcohol is actually a drug. It's actually a chemical substance. So when you take alcohol with flagyl, it produces a disulfiram-like reaction, which can make the person very uncomfortable. It can make the person have low BP. it can make the person like just be feeling very uncomfortable, very discomforted. That is why that reaction can also be put into an advantage in stopping somebody from taking alcohol. What you need to do is to place the person on metronidazole, which is flagyl. Whenever the person takes the alcohol with the metronidazole, it will produce a disulfiram like reaction. Even the disulfiram I'm talking about is the name of a drug which is used for treating chronic alcoholism too. So the way it reacts, that is the way alcohol with flagyl also react. That is why it is called that disulfiram like reaction. So we have drug food reaction. Drug food reaction is when the food that you eat reacts with the drugs that you have taken. For example, when there are classes of drugs known as tricyclic antidepressants. Example of the drugs under that group includes the amitriptyline. The amitriptyline, the trade name is triptizol. The clomipramine, the imipramine, the which other one again? Okay, let me just center on those ones. The amitriptyline, the imipramine, the clomipramine, and so forth. These drugs should not be taken with tyramine containing foods. When it's taken with tyramine containing foods, it reacts in the body, thereby enhancing the reaction of the tricyclic antidepressant, making it to overreact. That is what it does. And it is not also good to take some of these drugs that are centrally acting with grape. It is not good to take them with grape. There is also some a drug known as, it's actually a herbal drug known as St. John's wort. St. John's wort also react with several drugs. So take note of that. I won't talk much on that. Maybe next time I will still throw more light on St. John's wort. And so that is an example of drug food reaction. Then we have drug disease reaction, like the one that occurs when somebody that is having an ulcer takes a painkiller. The painkiller goes inside the body and it aggravates the disease. It makes the disease to become more intense. Yes, make the disease to become more intense. Like I said before, if it ruptures a major blood vessel, the person can start vomiting blood, which can lead to anemia. And if the person is not properly treated, or if the person is not rushed to the hospital, when there is too much loss of blood, the person can die in the process. So there is also what is called which other one now? Drug receptor reaction. Drug receptor reaction. Actually, in this case, it actually occurs when two drugs are taken together, and those two drugs have the same receptors. For example, receptors and the drug that bound to them, they are like a key that opens a door. So if you put that key on the door will be open, but if you put another key, it will not open. So that is the relationship. So when a particular drug is supposed to pass through a receptor, and the drug gets into the body and doesn't find that receptor, then the drug is going to remain in the body, causing side effects in the body, because it will just be accumulated in the body. The receptor that will carry it to the places that is needed is not there. And most of the time, the diseases that we treat, like bacteria, they can destroy some of these receptors, knowing that it is through these receptors that this drug passes through to attack them. So they destroy some of these receptors, especially gram-negative bacteria. And also there is this general saying that when you take some drug and you start reacting to it, some lay people say that the drug is actually pushing out the disease inside, from inside. Sometimes it is not sometimes, almost all the time it is not like that. There is also a reaction that occurs with sulfonamides. Sulfonamides are they are a group of drugs that are used for most especially respiratory tract infection. They can also be used for gastroenteritis. So the group of drugs that belongs to this group includes which are the sorry. The drug that belongs to this group include like the one you call M1B33, the M1B33. Then the one we call Septrin. Septrin belongs to this group of drugs. Septrin is a combination of sulfamethoxazole and trimethoprim. So there are different types of different group of drugs that belongs to the sulfonamides. The M1B33. You have the talazole. Talazone is also a sulfonamide, and the kind of reaction that this drug actually reacts is usually the type of reaction that it is actually genetic. It is genetic. It is all just like when somebody takes chloroquine. Some people, it itches them, or quinine, it itches them. Somebody like me now, I can't take quinine, because if I take quinine, it will itch me for about 5 days, and it itches me all over my body, including my tongues and my eyes, and even inside my palms. Everywhere will be itching, and it will even get worse when I use cold water to take my bath. It will become more intense. So that kind of reaction is also what is associated with this sulfonamide kind of reaction. But the sulfonamide kind of reaction, that one is more far serious, because it will just start forming blisters. It will just, when hot water pours on somebody's body, the way it will be bringing out blisters containing water inside of it, such that when you open it, the water will pour out, and the place will become an injury. That is how these reactions takes place. So that is that for some of the drugs reactions that I can talk about for now. And they will also let you know that there are series of drugs like the antihypertensive drugs, the anti-diabetic drugs, the anti-cholesteremia drugs. Most of these drugs, they have the tendency to react together. But to prevent this reaction, we actually advise people take one, then after like 2 hours you take the other one. You wait after 2 hours before taking the other one. Or if there is one that you are taking in the morning, take that one in the morning, then in the evening you take the other one, so that they will not even meet each other in your system, talk less of reacting together. Because when two drugs react together, drug-drug interaction now, one can potentiate the effect of another one. So instead of reducing your blood pressure, it can be shooting it up. Or instead of controlling your blood pressure to a particular extent, it can even bring it downwards more. So these are some of the things that I have to say with drug interactions. The drug interactions, and also you don't take antacid like these drugs that are used in treating ulcer, the liquid drugs that are used in treating ulcer. You don't take them with any drug at all. You don't take them with any drug at all, because when you take them with drugs, they can make that, they can chelate, they are chelators, they chelate that drug and make the drug not to work in the body, and so please don't take. Usually tell the person to wait for like 2 hours or 2.5 hours before taking after taking the antacid, before taking the next drug question. Please get a kind of noise in the background, and I will like to stop here for now, and I will continue later, and I will also continue from where I stopped, and I will continue later. By that time I will be pointing specifically on some drugs. Thank you very much, and God bless you.